Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
We're predicting is going to be much worse in the next week or two.
Exhausted frontline workers brace for what's to come.
It has the potential to take away some of the scary parts of a novel virus.
Confirmation that a taste test can predict how COVID can affect you.
40% of the people who are turning to us for help now have never before relied upon the charitable food system.
The pandemic's attack leaves more and more people hungry.
Hi everyone and Merry Christmas. I'm Kara St. Cyr.
And I'm Andre Moreau. Hope your holiday is safe. Much more on those top stories in a moment on this week's edition of SWI.
But first, the latest on the coronavirus from the governor's office. Numbers are still rising, which means he's extended his modified phase 2 order.
The mask mandate will stay in place. The current occupancy of restaurants will stay at 50%. Bars and parishes with a percent positivity of above 5% are going to be closed to indoor consumption. Gatherings indoors are limited to 25% of the center's capacity, or 75 people.
And now we have a look at other headlines making news across our state.
The state Supreme Court this week sent a legal feud between the governor and House Republicans over coronavirus restrictions back to district court. Their opinion, the judge ruled too quickly that a state law used by the GOP to nullify the restrictions was unconstitutional. The justices wrote in their opinion the judge should have held a full hearing on other issues raised in the lawsuit. The governor will enforce COVID-19 restrictions while the case is pending. As shipments of a second coronavirus vaccine began coming into the state, a new audit says labs are taking so long to report COVID-19 data that it's often not useful to fully know the scale of the outbreak. It questions if the governor is getting adequate information to set restrictions on businesses and activities. A new survey by Mental Health America healthcare workers finds most report feeling emotionally exhausted being on the front lines of the pandemic. 93% say they're stressed, 86% report they're anxious, and 75% report feeling overwhelmed. Stressors include risk exposure daily to the virus and work conditions that are compared to being in a war zone. Shreveport's Independence Bowl has become a casualty of the coronavirus. Officials say the number of teams opting out has left a lack of teams available to fill bowl slots. 9-2 Army had already accepted a bid to play in Shreveport, but will play in the Liberty Bowl now instead. A committee of state lawmakers this week approved a plan to find a private partner to build and maintain a new Interstate 10 bridge over the Calcasieu River in Lake Charles. This firm would use tolls to recoup their investment. Department of Transportation Secretary Sean Wilson says the public-private partnership is the only way to get the bridge built, and the tolls would have to be reasonable. Cost estimates are $600 to $800 million.
And a few other headline notes. A house cleaning for LSU football following an awful 5-5 season, their worst in 22 seasons. Out is defensive coordinator Bo Pelini and other defensive coaches at a high cost also. Offensive coordinator Steve Ensminger will step down and be reassigned. The season even more of a stunner because it followed that national championship year.
Also this week, the governor and Amazon announced Karen Crow in Lafayette Parish will be the home to the company's first fulfillment center in Louisiana. It will create 500 direct and almost 1,000 indirect jobs with an annual payroll more than $16 million. It's set to open a year from now, December 2021.
What if you knew you were more likely to get very sick if infected with COVID, or you may not get very sick at all? The Baton Rouge General Hospital says the results of a new study confirms a taste test that centers around the research of a Baton Rouge doctor can predict COVID-19 outcomes. It's a major update to a story we first brought you in mid-September. Remember the taste test pioneered by Dr. Henry Barham of Baton Rouge and the Baton Rouge General Medical Center?
Basically, I'll just give you a couple of strips of paper, and with each one, you just basically lay it on your tongue and suck on it to try to induce a taste. And then you tell me, do you taste sweet, salt, bitter, or nothing?
I didn't taste a thing. He gave me the test in our first report, and when I didn't sense any taste, that put me in a group of people labeled as non-tasters, at high risk for severe problems if infected with COVID-19. Turns out that Barham, a rhinologist who spent years studying the relationship between taste receptors and sinus problems, was onto something big. There's confirmation now that this seemingly simple taste test can predict COVID-19 outcomes and severity.
Or has the potential to take away some of the scary parts of a novel virus. You know, you hear these stories of young people who get really sick without comorbidities, and you know, other people who have comorbidities who seem to do fine. And there's this fear out there where you have family members or you have friends who got very sick from the disease, and you didn't really know why. And you have some people that don't get it with seemingly high exposure, and some of it doesn't make sense. It looks like the non-taster group tests positive for COVID more frequently and have much more severe and longer duration of symptoms. Specifically, the average duration of symptoms in the non-taster group was 23 and a half days or 3.5 weeks versus the super taster group, which average duration was around 5 days.
At the time I took the test, Barham told me further testing could actually show I had the genetic makeup of a taster, but with age, my genetic receptors had dulled. This past weekend, at a holiday gathering with my siblings, Barham, who is my nephew by marriage, got on a FaceTime call as we all lined up to take the test. My sister, his mother-in-law, administered it. One difference, though, from my first test, Barham told me to drink black coffee just before. And the result...
Oh,
yeah.
Look at him.
This is like totally different. Barham says the black coffee stimulated my genetic receptors. I am a taster after all. According to this data, better equipped if I got infected.
And this has been a really an interesting project to find in the middle of a pandemic, which has dramatically changed our world. It has been, the findings have been incredible.
You're the one who put this to the test first, though. What was the nugget that made you devise this system?
When COVID first started, I kept dealing with a lot of COVID positive patients doing airway surgery where presumably high exposure with daily exposure in patients in the operating room, in the COVID ICU, in clinic, we were seeing people with active COVID, and I never got it. And so if someone were truly to have protection to a novel virus, it would have to be something with innate immunity. Presumably, it would have to be something with innate immunity, which is something that you're born with. The potential importance of this is the predictability of one's infection or one's reaction should they get COVID-19. People who are most at risk of getting a severe and prolonged course of this illness should be first in line to get the vaccine. People who are not would appear to have a much shorter and easier course should allow the others who have the potential to get more sick to get the vaccine. We're trying to figure out now how to administer this test on a global or on a much larger scale. I think we're close in figuring out how to do that, but we will continue to follow our data, continue to go through the peer review process to find any potential holes in this study, and as soon as it is available, to get all of the details out to the public.
The low cost of this taste test is another bonus.
From an altruistic standpoint, I think that this test is beautiful. that you have the potential to predict severity and duration of symptoms of a novel virus with an inexpensive and easily administered test.
Dr. Barham says a taste test for the flu is in the works. If you want to know more about the test, we've got a link on our website to his clinic, lpb.org/SWI.
No one could have predicted the storm that would come when 2019 ended. The pandemic, the phased reopenings, and the impact they'll leave behind are still unfolding for us. But now that 2020 is ending, here's a look back to where it all started. COVID-19 was the beginning of an era in all the worst ways. While Americans popped fireworks on January 1st, Wuhan, China was battling something we hadn't heard of yet, the coronavirus.
On March 9th is when we got our first confirmed case in Louisiana. It was an individual that lived and worked in the greater New Orleans area.
At this point, what we knew about the virus was limited. Some people were still confusing it with the flu. The CDC was reporting that it caused shortness of breath, dry cough, sore throat, and sometimes a headache. But that's all. We also didn't understand how it spread. While scientists tried to figure that out, Louisiana was quickly becoming the state with the highest cases per capita. Just days after the first case was announced, the state declared its first death on March 14th.
For those first couple of weeks in mid to late March, we actually, for a 2-week period, had the fastest growing outbreak of anywhere in the world to date, faster than China, faster than South Korea, faster than Italy.
In a press conference in mid-March, Governor John Bel Edwards declared the state on lockdown. All non-essential businesses were asked to close or find a safer way to operate. It was good to contain the spread, but devastating to business owners. Tommy Satanovich, the owner of Drago's Seafood Restaurant, says that his business is struggling. Right now, he's got tables filled with customers, but that's only portions of his restaurant.
My restaurants are struggling right now. I feel horrible for the smaller mom and pops, which is the backbone of our industry.
With each phase, Satanovich was given more slack, but the adjustments still weren't enough to fill in the financial gaps. Satanovich estimates he lost hundreds of thousands.
In the New Orleans area, we were able to take a relationship that was an already existing relationship and change that to become a pandemic response fund.
Kelly's foundation bails businesses out during their lowest moments. The pandemic doubled her clients over the course of a few months.
At one point, when I was just, hey, how's it going? It's the worst thing to ask in some of these business owners in some of those tough months. And I hit him in a bad day, and he told me, he's like, I don't know how to even talk to you right now. All I can think about is the millions of dollars that my business is losing per month.
The foundation was able to shell out $2.4 million to more than 4,000 people. Dr. Louis Minsky, chief of staff at Baton Rouge General Hospital, says the impact of the stay-at-home order came with its pros and cons.
Well, I think it had a number of impacts. The obvious is the economic and simply the fact that individuals and families and groups were made to stay at home.
Officials were able to get COVID numbers down, but where we're at now and where we're projected to go, if things don't change, is worse, especially after Christmas and New Year's Eve.
We're in the middle of our third surge, very significant surge, which we're predicting is going to be much worse in the next week or two.
Some healthcare workers have already taken doses of the Pfizer vaccine, though the public probably won't see them until midsummer. Until then, Minsky and other healthcare professionals are holding on to the oldest rules in the COVID book.
Take all of those safe precautions to mitigate and minimize the risk that we pass the virus from one person to the next.
Dr. Minsky says waiting for the vaccine is only half the battle. The rest is all about patience and following CDC guidelines.
This year's most active Atlantic hurricane season on record was especially rough in Louisiana. We had 2 tropical storms and 3 hurricanes, with Cat 4 Laura and Cat 2 Delta the most powerful. They struck Cameron Parish and Lake Charles 6 weeks apart and left some people with big decisions to make.
My husband and I are 43 and 44, and we have to decide what's best for our family. It's a real question that people need to ask themselves. How will they manage to recover from significant events like this? Because they're not going to stop.
We have a long road in front of us, and there are still a lot of citizens who are without a home, who are still picking up the pieces, and there's still a lot of pain.
Laura washed away Marceaux and her husband's house. They won't rebuild, but they have found another they can repair. Mayor Hunter says the vast majority of Lake Charles businesses and people are staying put. During the pandemic, the hunger crisis in America has escalated. The Feeding America network of food banks now reports 50 million Americans face food insecurity. That's an all-time high. I sat down with Feeding America CEO Clair Babineaux-Fontenot.
When I joined Feeding America as CEO, it was 2018. And we had this good news story. We'd just gotten numbers in 2018 out of the USDA, which is the agency that actually measures food insecurity across the country. And we learned that rates of food insecurity had finally returned to pre-recession rates. And that was 37.5 million people in this country who were food insecure. That meant progress. Unfortunately, as a result of this pandemic, our estimates are that the rates of food insecurity in this country are soaring to 50 million people.
And the amount of elderly and children, it's worse.
We rank fourth highest rates of food insecurity for seniors, fourth highest rates of food insecurity for children, and we're roughly around that for food insecurity at large. Along with a health crisis, we have a food crisis that's come along with that in this country, and that the most vulnerable members of our society are hardest hit by all of it.
You've got people who may qualify for help from the government, food stamps, and the people that have never even tried to be qualified before.
40% of the people who are turning to us for help now have never before relied upon the charitable food system. A significant number of people who turn to us for help qualify and receive food stamps. It's now called SNAP, but they receive food stamps and it's not enough to make ends meet. Another group are eligible, but have not even applied and don't know that they qualify. And yet another don't qualify because they're right above that threshold, but they can't make ends meet. So when you have shutdowns, business shutdowns, these communities are particularly hard hit by those as well, because they tend to work inside of those industries that are most impacted by this pandemic. So it's just a triple, quadruple whammy for vulnerable communities.
What are solutions? Are there viable solutions that will work, having been thrown what has been thrown at you this year?
One of the biggest issues that we had was that people just didn't understand that hunger was here. It wasn't our concept of who we are as a country. Most kids that I grew up around, their parents would tell them if they were a picky eater, eat your food, because they're hungry children in Africa or they're hungry children in China. What this crisis has done is that at a moment when all of us were forced to be at home, watching our television screens, we saw with our own eyes the need. And I believe that's part of the solution right there. A raised consciousness on the part of the American public that has a history of being so generous, so kind, that in this country, knowing that there's a problem is key to solving the problem. So that was step one, and I believe that we've gone a long way to resolving that side of the equation. There are public-private partnerships that are going to be essential, and we're working hard at that. Feeding America is a nonpartisan organization, and what we've seen is bipartisan support for the work that we do. About half of the people who support our efforts self-identify as Democrat, and about half of them self-identify as Republican, because I think the American public equally understands that this has to be an all-in fight. So continuing along the path of agreeing that no one in this great country should be hungry, that no mother in this country should wonder how they're going to feed their kids, that shouldn't happen here, that our seniors in this state should not have to figure out, am I going to eat today, or am I going to get my prescription drugs that my doctor says that I need? So I believe with us having that raised awareness and having that I call it a spirit of liberality, but having that generosity of spirit, that triggering those together, I think is definitely going to be a part of the solution. So thinking through in an innovative way, ways that we can make an impact. And then there's definitely a role for government to play. It's not a sole role, but they've got a role to play as well.
Is that a change of policy?
It's a combination of things. Let's take SNAP, food stamps. We know some things about food stamps. Like we know that as remarkable as our network is, and we're the largest hunger relief organization in the United States. We have 5 remarkable food banks right here in the state of Louisiana. So those 5 all work together, and in doing so, they do remarkable things for our society and in this state. But they can't do it alone, and we know that for every one meal that our network can provide, or that the charitable food system can provide, SNAP can provide 9. It's a much more efficient way of getting food to people.
Right.
We also know that for every $1 invested in the SNAP program, the return to the economy is about $1.70. So it's good for the economy, it's good for people, it provides people with choice. So one last data point, the U.S. Bureau of Labor Statistics recently published a report that says that grocery prices are at a 50-year high, but there hasn't been an increase in SNAP benefits.
Right.
So I center it on that as one great example, that by increasing the amount that people receive through SNAP and trying to track with the increase in retail grocery pricing, that's a really, really powerful thing that we can do. I believe that there are some things we can do systemically to address what it is that helps people to move from food insecurity into financial security. Mm-hmm. And walking along that path with people and empowering them, in fact, to move from where they are to this remarkable dream that I get to live every day in this great nation. That's what I really think the ultimate answer is. So there's short-term solutions, but that we need to think of them that way, short-term. There are mid-term solutions, and then there are long-term solutions. And in that long-term future, it's people empowered to provide for their own families with their own funds that they earn themselves.
What a pleasure to visit with you.
The pleasure was mine. It's always good to come home.
For more information on how to help Feeding America, we have a link on our website at lpb.org/SWI. Louisiana Public Broadcasting has been an advocate for Louisiana parents for 45 years, and we're pleased to announce a new multi-platform initiative that's designed to improve the overall well-being of our children.
The One to Grow On series of video shorts launches in January, both on air and online. This month, Louisiana Public Square explores some of the topics that One to Grow On will cover and gives a preview of the series.
We just heard that the death rate for pregnant women in Louisiana is twice the national average, with homicide being the leading cause.
I think the 3 key components to addressing this very unfortunate part of society is that, number 1, you have to ask the questions. Number 2, you have to ask the questions in a non-intimidating way and create a safe haven for patients. And number 3, you have to be ready to intervene so that you can make a change and improve the lives of your patients.
So by waiting till 39 weeks, you have a higher chance of full lung maturity, which will help the baby as they transition from mother providing all their oxygen to them having to use their young lungs and be able to breathe on their own. The other thing is they're going to be higher weights, so there's going to be less chance for low blood sugars. They're going to be able to have more of a temperature stability on their own by being more full term.
What if your kids just finish their plate and they're like, I want more, which my kids do this.
Right.
I say, there's a rule. This is a rule for my patients and my kids, 20 minutes. You gotta wait 20 minutes. It literally takes 20 minutes for your stomach to talk to your brain, and then you say, go play. When you come back, if you want more, you can have more fruits, more vegetables, more protein, but no more grains.
Now, in this day and age, we know screen time is going to be there, though. And so if we are going to be watching screens, let's focus on it being educational, involved, and make sure we're not sitting for too long, so taking some breaks. If we are going to be watching the screens, we want to make sure we're involved with the entire family and also involved with what's being shown.
Sleeping with your child can increase the risk of suffocation by 40 times. You want to make sure that you offer your child a clean, dry pacifier before going to sleep. Now, if they don't want it, don't force it. But what the pacifier does is keep their brains aroused.
Guns should be stored in a locked gun cabinet with locked trigger locks, and ammunition should be stored in a separate area and also under lock and key. The most important thing is to remember, though, that those at risk, your children, your adolescents who live in your houses, they don't need to know where the keys to the gun safes are. You know, you need to keep that in a separate area that only you know where they are. So this limits access that children have to guns.
We can do very inexpensive tools multiple times throughout the day. The mother can employ these during her pregnancy. She can share them with the other members of her family. Things like as simple as turning to her breath and making it slower, deeper, quieter, and more regular. The other things that can be done are free meditation apps. One of my absolute favorites is nature. Time in nature is almost like a Valium pill in a way. It completely melts away stress, and it doesn't have to be for long.
Children's Health Matters re-airs this Sunday at 11 a.m. The program features an interactive survey during the broadcast. Learn more at lpb.org/publicsquare.
And everyone, that is our show for this week. Continue to have a safe holiday.
We leave you with a look at Christmas at Louisiana Governor's Mansion.
Good night.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.